Well, cases of Omicron continue to spread across the U.S., Nebraska becoming the latest state to be added to that list. But what does this new variant mean for those on the front lines of fighting this pandemic? Local 5's Mary Sugden joins us in studio to share that message from doctors.
Stephanie, while the Omicron variant comes with many unknowns, medical experts on the front lines say we need to learn how to better live with this pandemic, which means taking steps to ensure we don't end up being their patient in need of critical care.
The number of COVID-19 patients in Iowa hospital beds is growing, with today's numbers hitting a record high not seen since last December.
It is very unfortunate and kind of frustrating for healthcare workers to continue to see relatively young people with no underlying medical issues really coming into the hospital and getting seriously ill.
But as we get closer to the 2-year marker of this pandemic, health experts say it's important to appreciate all we've learned.
We have the monoclonal antibodies. We have a lot of those other things now that we didn't have before. So, I mean, there is the fatigue, but there's also the hope in that as we've gotten through this, we're handling it smarter.
But one thing that isn't certain, when and how this all will end.
Most of us are pretty convinced that this is going to be with us for a very long time. Eventually, it will become more endemic, but nobody really knows when that time will be.
The first time we had an influenza outbreak, that was 100 years ago. And we're still getting influenza shots every year.
And while Omicron is the latest variant to grab the attention of the global stage, doctors say this will continue until vaccinations greatly increase.
And as long as there are unvaccinated people out there, they are actually acting as, vessels of viral evolution.
And even though doctors say there are those who make their work harder, a thank you must be said to the countless others doing their part.
We're having more people that are electively getting tested just out of consideration for others.
And something doctors also wanted me to stress, the vaccine doesn't 100% prevent you from getting COVID, but it does help keep symptoms much less severe. That in turn will help keep you out of the hospital. In the studio, Mary Sugden, Local 5 News, We Are Iowa.
Mary, thank you. Now we have 3 more things to know about Omicron. The Iowa Department of Public Health says they are actively screening for it at the state's hygienic lab. Health officials have confirmed the new variant in at least 6 states. Still, the Delta variant remains the dominant strain in Iowa and across the U.S.